Hello again, my name is Dr. Martina Assad, and I'm the owner dentist of MA Dental in Riverside in California. And today we have a great topic, a very important one, and it's about dental cleanings. So there's the very first question we get asked, which is what is the different types of dental cleanings? There are, simply speaking, either a surface cleaning, or we call it a prophy, or like a normal cleaning, and then the other one is called a deep cleaning, which it requires a little bit more effort and requires anesthetics, and then also after that followed by maintenance cleaning, which is similar to a normal cleaning. Again, what is the importance of dental cleanings? And it's as simple as this: when you're trying to build a building and you have a straight foundation like this, you cannot put the roof if the foundation is shaky. So dental cleanings is pretty much is the foundation for what we do. The inside of the gums have to be strong and healthy and has to be tight for us to build the roof, like put a filling or put a crown. So that's why people are super important to keep up with cleanings before we can do even cosmetic work or anything. How often should we have a dental cleaning? And if you're a child, every 6 months at least. Some adults, depending on where they fall on the spectrum, I have a lot of patients that like to be seen every 6 months for a cleaning, but the bare minimum is at least once a year. Is dental cleaning is painful? And the answer is absolutely not. Depending on where you go, as far as our office goes, we have top of the line equipment. We have the newest cleaning tools on the market. We call them electric piezo's. So they do not vibrate as much as the old way of doing things. So it's very comfortable. We also have water warmers, which helps a lot with sensitivity. So how long does dental cleanings take? And our appointments usually range between an hour to an hour and a half, depending on the severity and the extent of the cleaning. What happens during a dental cleaning? So usually if I am doing the cleaning or my associate is doing the cleaning, we like to use the tool first and get rid of any deposits that you may have. And then after that, the staff will polish and floss, and we'll go over hygiene, follow up and see where the spots that were affected more or whatnot. But we usually like to implement routines. If my hygienists see you, and I have two of them, they like to start the polish process first, and then floss, and then go back with the tool and clean everything they may have. And just is different for people. So, and we still also implement routines and make sure we give you techniques and guide you at home so you can maintain what we just did. If the dental hygienist is able to remove any tartar or any deposits the patient may have, and the answer is absolutely. They're licensed to do so, and that's the very first thing they actually do. So the answer is yes. Can dental cleanings damage my teeth, especially if you have veneers or you have crowns or something, or implants? The answer is possibly yes. If the dentist or the hygienist is not careful, some tools are very powerful. Some teeth can get nicked by accident. So, but this is not a concern at our office because, again, our machines are very controlled by electrical vibrations. So we have the power to turn it up or turn it down depending on how comfortable you are and how severe the situation is. So, but by then, if we're gonna get to a point that things are damaging, you will be feeling it. And so we watch out and make sure that doesn't happen. How do we treat sensitive teeth after cleaning? As simple as keeping up with your oral hygiene. And also we can recommend Sensodyne, which really helps. We can also have a prescription toothpaste and some prescription mouth rinses that can help you move forward. But it all starts with good oral hygiene habits at home. And so that concludes the end of our small interview today about dental cleanings. I hope I was able to answer any questions you may have. If you do have any other concerns, or if you'd like to schedule your next appointment with us, we'll be more than happy to help you. So please feel free to call us at 951-327-7247. Thank you.